আসসালামু আলাইকুম বন্ধুরা, আপনাদেরকে সকলকে স্বাগত জানাচ্ছি ফিজিও নিউজ 24 এর পক্ষ থেকে। আমি ফিজিওথেরাপি চিকিৎসক সৈয়দ শামীম হাসান। বেশ অনেকদিন পরে আপনাদের সঙ্গে আমরা যুক্ত হচ্ছি আমাদের চমৎকার একটি লাইভ সেশন নিয়ে। আজকে আপনারা জানেন যে আমরা আসলে সারা পৃথিবী থেকে আমাদের সঙ্গে যুক্ত করি স্পেশাল চিকিৎসকদের। তাদের কাছ থেকে আমরা চেষ্টা করি নলেজ শেয়ার করার। আর তারই ধারাবাহিকতা আজকের আমাদের এই ওয়েবিনার, যে ওয়েবিনারটি পেইন ম্যানেজমেন্ট উইথ ফেসিয়াল রিফ্লেক্স। তো বাংলাদেশের প্রেক্ষাপটে বা আমাদের দক্ষিণ এশিয়ান প্রেক্ষাপটে আমরা কিন্তু আসলে ডিফারেন্ট টেকনিক গুলো আসলে খুব কম ইউজ করা হয়। তো সেই ক্ষেত্রে ফেসিয়াল রিফ্লেক্স এই ব্যাপারটি কিছুটা আমাদের জন্য বোধহয় নতুন, বা আমরা বেশ এনজয় করবো আজকের এই সেশনটি। আর আজকে আমাদের সঙ্গে জর্ডান থেকে আমাদের আজকের ইনস্ট্রাক্টর আমাদের সঙ্গে যুক্ত হবেন। আর সম্পূর্ণ প্রোগ্রামটি মডারেট করবেন আমাদের সঙ্গে ডক্টর শান্তনু মল্লিক, আমাদের পরিচিত মুখ, আপনারা সবাই তাকে চেনেন। তো আমরা এখন যুক্ত হচ্ছি আমাদের আজকের অতিথিদের সাথে। আর যারা বাংলাদেশ থেকে বা ইন্ডিয়া থেকে বিশেষ করে দেখতে পাচ্ছেন, সকলকে স্বাগত জানাচ্ছি। বিশেষ করে সারা পৃথিবীর যে প্রান্ত থেকে যারাই দেখতে পাচ্ছেন সকলকে ফিজিও ইনস্টিটিউটের পক্ষ থেকে স্বাগত জানাচ্ছি। হ্যালো স্যার।
Okay. Assalamu alaikum.
PhysioNews24.com.
Thank you very much for Physio News to introducing me in this webinar. I hope I can deliver this amazing therapy in the right way, in a simple way for you all. As a physical therapist or even occupational therapist, or everyone who is working in medical and paramedical field, this therapy is amazing thing to learn, amazing thing to know about. I would like to share with you a simple thing about how to ease pain from different parts of your body, whether from head, from neck, from lumbar spine, from ankle joints or elbow, whatever, in a simple way, only through face. But first of all, I would like to introduce myself, and I would like to introduce about the International Institute of Reflex Therapy in Barcelona, Lone Sorensen. So again, thank you very much for this host, and I will start now.
Okay, sir. So first of all, I'd like to thank you, sir, for from Jordan. You have come here and you have given us a nice time, and also thanks to you for sharing your knowledge. And I think it will be a great pleasure for us to know some new concepts from you and our Bangladeshi physios, and maybe our neighboring country, India, Pakistan, and others country. They will also today they will also learn some new concepts. And already I have taken one of your classes. I think it's a very nice approach and a very magical approach. I know that, and so we hope that we are going to learn very soon. And I will thank you, sir, and please continue, sir, because we have limited time only.
Yeah,
thank you,
I hope so. Thank you.
I'm with you.
Okay.
Yeah.
Thank you. I will start now with the introduction about this therapy. I will share something now. Okay, here we are. Okay, so we are going now to talk about facial reflex therapy for pain management. It's supposed to be a 3 hours workshop I used to do, but for now we have like 90 minutes to talk about this one, which is enough for us. Now, the thing is that you have to know that we are talking about, let me put an arrow or pin highlighter. Okay. So here's the main logo of our institute. This one for facial, according to Sorensen system. Remember, Sorensen system. Maybe you'll find another schools in the world that's talking about facial reflex therapy, but it's not our school. If you see this logo or this one, original method Lone Sorensen, then is that what we are talking about, even if he's an instructor, authorized instructor, or a therapist who deal with this kind of therapy. Okay, First of all, I would like to introduce this amazing lady, the superwoman, Lone Sorensen. Lone Sorensen is a Danish instructor. She's the one she's on and built up the International Institute of Facial Reflex Therapy, Lone Sorensen. The main office it's in Barcelona, and she has the largest school, as well as she's also doing live webinars since long time ago. And she has her education since 1978, and she also learned many things like anatomy, laser therapy, reflex therapy. She's the one who is developed what we call it in Spanish temprana reflex therapy. Temprana is a rehabilitation system in our concept, so I will talk about later. Of course, Lone Sorensen, her first reflex therapy school in Copenhagen, Denmark, and 3 schools in Argentina. She's a therapist educated in reflex therapy, acupuncture, kinesiology, aromatherapy, and neurology, working in Denmark since 1978, and France, Chile, Germany, Argentina, and Cuba. She lived 10 years of professional experience in Denmark, 13 years in Argentina, and until now she's her office in Spain. So she develops facial reflex therapy, neurofoot reflex therapy, and temprana rehabilitation based reflex therapy methodologies combining therapies from Oriental medicine, acupuncture, and primitive techniques of aboriginals and zone therapy with neuroanatomy. Of course, this I'm not going to talk about this systems because it's a long one, and if anyone who is interested in learning the full diploma, he will know about all these things. But I should talk more about Lone Sorensen. She received 3 nobility titles from OMHS Humanity, a World Organization, Pro Health in Argentina in 2001 for her works with reflex therapy, especially for children. And she has an honor title from the World Women Leadership in 2017. So Superwoman. Of course, the international schools of reflex therapy it is in 21 countries and teach with 33 instructors. Her patent concept reflex therapy in Spain, Denmark, Sweden, Finland, England, Ireland, Poland, Czech Republic, Turkey, Portugal, Holland, Slovenia, Slovakia, etc. Of course, in Jordan and in the Middle East now. So we have also one new instructor since last year. He's Indian in India. He's also a physiotherapist. He became now a teacher of facial reflex therapy. Okay. Excuse me, I would like to give you a brief about myself. I have a BA of physical rehabilitation in Jordan in 2004. I learned many complementary therapies like Swedish massage, shiatsu, Japanese technique, acupuncture, and reflexology in 2004. I worked in Emirates as a physical rehabilitation specialist, and also I was like a spa manager for 3 years. Then I have my own private business since 2010. I became the first and the only international instructor of TCM foot reflexology, according to Lone Sorensen, facial reflex therapy as well as. And also, I am temprana reflex therapist. I'm also working with the rehabilitation system for brain and nervous system for many kind of brain damages and brain dysfunction. And I'm running. I have my own clinic in Jordan. What we call the clinic is Cure Center. Okay, so now the programs and that the International Institute of Reflex Therapy we teach and we deliver. First of all, facial reflex therapy diploma. Now, today you are going to learn a small part of this diploma on face. We teach also TCM, Traditional Chinese Medicine Foot Reflexology Diploma, Neuro Foot Reflexology, which is amazing one course for if you want to deal with posture issues through feet. If you have problem with the spine, you can treat it through feet in an amazing way. And also we have what you call Tibetan reflex therapy, and a very old therapy to deal with many kind of issues like muscular, organs, hormonal, physical, and psychological issue. There is another tool called thermi reflex therapy, which is according to the school, we will use some Japanese herbs to apply it on face or feet or hands to treat many kind of issues. We have another line called hormone and fertility course. It's a specialized reflex therapy course through face to treat hormonal imbalances and help people who have infertility problems, and which we have amazing results in that. We have also neuro hand reflex therapy, to how to apply neuro reflex therapy through hands to treat also many issues through spinal cord. We have also ocular reflex therapy, how to treat many ocular problems through face in this way. And the biggest and the largest program, we call it Temprana reflex therapy. Temprana in Spanish means early intervention. Okay, so it is an early intervention for children, for adults, if we have brain damage, autoimmune diseases, like which needs long time or long-term treatment. So this is Temprana reflex therapy. Okay, what we are talking about now is, what is facial reflex therapy? Facial reflex therapy is, according to Sorensen system developed by Lawrence Sorensen during 40 years, can be defined as a reflex technique based on the neurobiochemical action resulting from the stimulation of an area or point on the face, which has a general or partial effect on various areas of the body. Okay, it is based on 7 steps that involve the observation and stimulation of various facial areas. I will show you in a map. This unique therapy is an important tool and part of Temprana rehabilitation system, which is a comprehensive treatment system used for rehabilitation for neurological disorders. Facial reflex therapy makes it possible to conduct nerve impulses through the central nervous system to the brain. With facial reflex therapy, it is possible to treat symptoms in organs, chemicals, physical, and hormonal functions in both children and adults. I will explain it later and how it is connected. Okay, of course, there are main benefits of facial reflex therapy, but it is of course it is a main benefits. We have many benefits of facial reflex therapy. As I said, we deal with neuropsychological and brain diseases, organ-related symptoms like stomach, colon, liver issues, etc. Muscle pain and muscle tension, stress-related symptoms, any health issue related to stress, facial reflex therapy is the best choice to treat. Hormonal imbalances, as I said, and emotional imbalances. Okay, this is the main thing. Okay, how we deal? Of course, I don't know if most of you know what is reflexology. It's the same thing, but we call it he tried to apply the effectiveness of foot reflexology through by applying and connecting the hand skills applying on feet, and put the patient on bed and he connected with EEG to check the electrical impulses to the brain, and he found that the electrical charge during stimulation is become from -70 to +45. Which is a huge one. He find in numbers when he apply underdermis. I will show you how. What is the meaning of electrical charge when it's happened? When you do this electrical charge, this means you help the cells to receive more ions of sodium, potassium, and calcium, etc., and which is help the cells to get nutrients, more nutrients when you apply this kind of therapy. Of course, we call this kind of therapy as microsystems. Okay, so we have many microsystems in our body. Lawrence Sorensen has discovered this one through face. Okay, we usually know about the feet. Of course, all of us have seen through Google and some books in Chinese that there are a map on feet or hands for you can find organs like stomach, colon, spleen, pancreas, etc. But nobody knows about face. Okay, now face here it is also exists. So we also talk about in terms microsystems. So every human being has microsystems. Microsystem on face, microsystem on feet, microsystem on hands, even on iris, even on nose or ears, or even patella on the knee, or every short and long bones. We have lots of microsystems in our bodies, so that we have a huge and amazing alert system and a cure system in our body. Just need to discover and work on it. Okay, so we are talking about cellular activity charge. Of course, when you apply reflexology or reflex therapy, we are allowing the cellular electricity charge and sharing every single ions in our cells, which means that we are helping our cells to work more and more. Of course, one of the best things or best advantages of working on reflexology, that we help the body to improve blood circulation in every big and small single parts of our body. When you improve the blood circulation, this is very important to allow more oxygen in the cells, and to release and to remove all toxins in our bodies, which helps at the end to work to help all vital organs, every single part of our body to work in the right way. So when we are talking about reflex therapy, what's going on? When I'm going to apply this therapy, whether on face or hands or feet, in a specific way, here I'm sending an order through the dermis. We have a skin and we have a dermis. When we are working applying manual stimulation on the dermis, we are sending an orders to the brain, telling the brain that there is something wrong in a specific part of our body. At the beginning, he is not going to understand what's going on, because he receives during treatment hundreds of orders. He will take like 24 hours or 48 hours to understand what's going on. Once he understands, he's gonna send hundreds of impulses for different parts of the body. For example, I'll give you an example. If I have a patient who is suffering from headache. So when I'm going to apply this headache, this application through face, for example, in many stimulation, here I'm sending an order to the brain. The brain, he is gonna answer me by sending impulses to the weak area that I'm telling him that there is something wrong. When I'm trying to touch and stimulate, rub, like press and pull, like when we said a few days ago in our last workshop, here there is a nerve ending, a micro nerve ending in the body, which is telling me that there is something wrong. Okay, so I will explain it in different way. We have what we call it deposits. Deposits, it's accumulated in under skin on the dermis in 5 stages. 5 stages. It is an assessment way for us. So when we are working with the reflex therapy, we are trying to find out the largest deposit. What is the main issue? Again, when I have a problem, as we are talking about reflex therapy for pain management, let's talk about like who has a frozen shoulder. Here, when I'm working on applying on the map that we are going to learn today, we are looking for a deposit. The first grade, you'll feel it under the skin when you are working. It's like a salty, like salt feeling, but it's not painful when I'm pressing under the skin. The second grade, it's like swollen rice, like a rice size, but it's not painful. Grade 3, which has become now more serious, more health issue, become like inflammation under the skin. You can feel it. And grade 4 become a mobile knot, movable knot. It'll be painful when you are touching it, which gives me an idea how worse this part of the body is, and it will come like a disease or injury. The worst one is grade 5, which is not mobile knot or immovable knot. Immovable knot. Okay, this is the worst thing. So when we are trying to diagnose or trying to assess the patient with the reflex therapy, we are looking for which part of the body have the largest deposit. If we find out that, for example, that we have a grade 3 in the right shoulder of the patient, that gives me an idea that is something wrong going on in his shoulder, maybe an injury, maybe a tear. Okay, so when I'm working on the face area of the shoulder, I'm trying here to at least to ease pain and help him at least to increase range of motion when I'm working with him as a physical therapist. Okay, this is the most important thing to put on your mind, that we have deposits. Okay, this is also we are working. Let me discuss it in a different way. Now, our concept says that the vital organs, which is we are talking about stomach, spleen, pancreas, colon, lungs, liver, gallbladder, kidneys, bladder, which is urine bladder, hormonal system, and small intestine, heart, and circulation system. All of these organs, vital organs, are the most important parts of the body, not the brain. When those organs are working in the right way, then your brain is working well. Okay, when you have a muscular issue, every muscle group in our body is connected with organ. For example, let's give you an example as a physical therapist. If we are talking about a patient who suffers from always a pain in his triceps, a pain, not a spasm. He feels like a pain, and you are a physical therapist. You are looking for the source. You did massage for the triceps, or you did manual therapy for his cervical, but he's still in pain. I can tell you that there is a message from his spleen that the spleen is not working well. When we have an imbalance or like a problem in our organs, the organs always at the first time sending us a message through the muscles that is not working well, and we can translate that by we have like grade 1 or grade 2 of deposits on this organ. Okay, because if he's gone, if he went to the doctor to assess or to diagnose his like spleen, he will not find anything on the spleen. But in our way of treatment and assessment, we can find it, we have more accuracy than the medical way, because your body never lies. So, and we can treat it. So put it on your mind always that each muscle group has a problem or is attaching with the vital organ. Another example, the anterior and posterior deltoids are connected with the lungs. So if our lungs are working well, there is no problem, there is no pain or spasm in our deltoids. If we have like let's say gluteus problem all the time, which is lead to sciatica later on, gluteus problem, when we have it, that means that we have a problem in our blood circulation system. There's a problem, it's a message. If we have another example in quadratus lumborum in the lower back, it's a message from colon, large intestine, that it's not working well. That's why you feel pain in your in this area specifically. Rhomboid muscle, which is a huge problem for many patients, and we always, as a physical therapist or rehabilitation, we always like doing massage on it, and it's still stuck. It is a message from your gallbladder that it is not working well. So we have to work on the gallbladder first to treat it, and then I'm going to apply this treatment on the muscle itself. Okay, this is an example. Of course, you need to learn more about this one, but we don't have time. You have to come to the diploma to learn more and more about this therapy. It's, believe me, it is amazing experience. Whether you learn facial or feet or hands in our Sorensen system. Remember, original method Lawrence Sorensen is the largest school in the whole world and the best school in the whole world in this therapy. Okay, and I have many proof for that. Okay, okay. Now you are not gonna take this one. You only if you have registered in our diploma. But I can tell you, these colors are means for us that it is in areas for our internal organs, and it is the way how we find out the largest deposit. Okay, so it is we always when we have a complaint from patient that he have an injury or have a problem, we always looking for the largest deposit on this map, which is vital organs. As I said, kidneys, bladder, stomach, spleen, colon, lungs, liver, gallbladder, etc. Okay, so this map. What we are going to, of course, and these are the 7 basic steps in our protocol of facial reflex therapy. What we are going to learn today is step number 5. Okay, I will show it to you. But first of all, I would like, because we have time now, I would like to show you this one. Okay, now this map, the muscles, tendons, joints, and spinal cord can be simulated through face using the zonal map of physical body. Here's the physical body. Here we have the neck, the head, and the nose is our spine. The shoulders is in the eyebrow and under the eyebrow, all the hands, right and left. And here we have here in the area of sciences, we are talking about the pelvis and hips. Here we have the thighs, and here is the knees. Here is the tibia and calves. Here is the ankle joint and the foot. Okay, so because we don't have time, I will show you the video, the full video, how to apply it in the right way. Remember, I'm going to use only index. Never use thumbs. Only if you are going to work on the spine, on the nose, you can use thumb. But in other parts of the body, we are using 2 indexes. I will show you now how it is working. Okay. How we can Okay, so this was the like a view of our step 5 of facial reflex therapy. It is for muscular and joints problems, basically. So as you saw in the video, we are using only 2 index. So we have to do is to press and pull. Okay, this is the idea. When I'm going to apply this one, I'm looking for something wrong under like the deposit that we are talking about, or in some way, if you are not getting the right deposit yet, you can find the most painful area or the most painful part on the face map, okay, and keep going and apply and work on it and on your index. And then when it becomes softer, okay, you press on it for 90 seconds or 2 minutes. Okay, in this way, why I press on it? When I'm pressing on it, here I'm releasing, I'm sending an order to the brain to release pain inhibitors. Okay, and this way the area is connected on the face that it is connected with the like neck or lumbar spine or knee or etc. will sending a pain inhibitor to this area to release pain. Of course, this is not at full treatment because, as I said before, we are talking about how to connect muscles with the vital organs. If you learn it in the right, if you learn in the diploma, you can treat it easily. But at least in this technique, and you have a group who joined us last week in a webinar about this one, and they applied on their faces, on their wives or their of the patients also, and they have very good results and good results. Okay, so let's see. Let's give an example. If I have a patient who suffer from like C3 and C4 bulging disc, okay, here is, if you can see, here is the cervical spine area. Okay, according to Lawrence Sorensen, if I want to treat a problem of this map, I have first to work on the full map. You start from here and you go down, 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 and then you go to the right shoulder and hand, working on it, as you saw in the video, and the left one here. Then you go to the spine and go to the right and left. You, as a physical therapist, you used to work on the same area. Okay, I mean, usually on the physical therapy way of thinking, if the patient has a cervical spine problem, they only work on the cervical spine. Okay, but in our way, no, we always looking at the whole system, because maybe if you have a cervical spine problem, the root of this problem becomes from lumbar spine, because if he has a problem of lumbar spine. Okay, so again, I'm give you an example on my face, and please work on your faces and find. I want you to feel it. If you feel it, you can treat people. Okay, so here I'm gonna warm up, press and pull, always press and pull, and try to find out the most painful area, or to try to find a hard area. For me today, I had a neck pain in the right side. So for me here, this area, I can feel it hard. So I'm gonna press on it and work, press and pull, like this. Okay, like this, press and pull, press and pull. Of course, the area depends on the head itself. I mean, if we have a big head, big forehead, this area will be bigger to work, more space to work. Then I go down here. Here I'll start from scalp. I'm gonna work on the cervical or the spine. Here I'm using the thumb and index. I press and pull, press and pull, press and pull. Here, if you have a patient who suffers from disc in the cervical spine, you can feel it. You will feel a click under the nose here in this area, and he will feel pain here, but at the same time he will feel more relaxed. Let's keep going and doing like this, in this way. Okay, and when I'm gonna finish, I'm going to press on the area here for 90 seconds up to 2 minutes continuously. Just press and hold. In this way, I can manage the pain here. I can control the pain at least. Okay, of course it depends on the situation. As a physical therapist, when you are going to work on this system, you can finish your physical therapy session with a patient with this technique. Okay, for example, you used to use hot bags or infrared or like mobilization, etc., but the patient's still in pain. When you've done everything, every protocols you are going to use a patient, apply it. Let him lie down on his face, on a supine position, and you sit over him. Okay, use a cream or oil. Never use lotion. Use a cream or an oil you have. Okay, and try to be a natural one, because we are always looking for natural things. Okay, then you start to spread the oil and the cream on the whole face, and you start work. Okay, until you reach the area that he has a problem on it. Okay, let's as we said, if we have a problem of the frozen shoulder, and the frozen shoulder is anatomy and kinesiology, etc., we have to work first on the scalp, then we go down to the cervical, and we work on the shoulders. And remember, if you have a problem in one shoulder, you have to work on both shoulders, because we have to balance. It's not right at all to work on one side. You have to work on both areas. If we work here, here's the right shoulder, like this, in this way. Okay, like this. Here, if you have a problem in the shoulder or spasm around the area, in the trapezius and the deltoids, you'll find it. You'll find it hard and painful. Painful, but you'll like it. Once you are done from the right side and complete the whole hand, you go to the left side and work the whole hand. Then you press. If you have a right shoulder frozen, or frozen shoulder on the right side, you just press after working on it for 2 minutes. and you'll find that the pain is going to release. The pain inhibitor will release, and the pain will become reduced or maybe gone. Almost with our experience, the pain will gone. Okay? If we have a sciatica issue, here's the lumbar spine and the sacrum on the cartilage of the nose. So also you have to start from here and go down here and work here, and then work to the spine and work on the hips, because almost when we're talking about sciatica, the pain will radiate to the leg. Okay, and maybe it will reach an ankle, and in some cases they cannot move, they cannot walk. Okay, so you have to start from here and go down until you reach here. Then you work harder, more and more. Then you go to the, for example, if you have the sciatica on the right side, you do like this and press and pull. We're using the index. Press and pull like this. Okay, and here's the thighs. It will be painful for the patient who suffer from sciatica, but believe me, after if you work in the right way, the patient will thank you a lot, and even you can teach it to his family as a homework. We used to teach families a homework to keep going with that, and they will come to you and they say that you are the best therapist ever because you help him. Okay, and this also make sure to work on the left side. Here, if I'm working to the hip joint, here's the hip, and here's the thigh, right thigh, until I'm reaching here. Here is the knee reflex area. I'm still working on it. Then I change my hand to work on the rest of the leg, in the tibia and the calves. And if you have a muscle spasm in the calf, you will feel it. Here exactly is the ankle joint. Okay, then I'm working on it if I have ankle sprain, etc. And here's the feet, and it's the same way in the right and the left side. Okay, if you have, let's say, carpal tunnel syndrome, also I have to work from here, then go down, then go to the shoulder, to the hand, to the elbow, and here's this angle is the wrist joint. Never ever only concentrate here. You have to work from the root. Okay, this is the right way of applying therapy in our Sorensen system therapy. Okay, this put on your mind. It is very, very, very important note. Okay, let's go ahead. Now I will show you something, another method or thing that you have if you are using if you are a neurophysiotherapist, if you are working with pediatrics or spinal cord injuries or etc. I will show you something now that could help you a lot. Let me show you. Okay. Here is another map. This map is the zone are relating to the cortex of the brain and cranial nerves. This is what we call step 4 in our treatment, in our basic treatment on facial reflex therapy. This Vietnamese map corresponds to the 12 cranial nerves of the sensory and motor cortex of the brain. Okay, we have two parts of this map. The first part here is we are talking about the peripheral nervous system, the motor sensitive function of the whole leg, and here's for the whole hand. For example, if you have a CP child who have a weakness, of course, of delivering the brain order to the peripheral nervous system, he is a nice way to stimulate every day to work, and you'll get nice results on the legs or hands. That's number one. Number two, if you have a sensation problem, if the patient have a sensation problem due to brain injury or due to spinal cord injury, this method will help you at least to start help him start feeling the limbs, which is amazing. I will show you how we can work. On the other side, it will be the side of the head. It is for the whole sensory issues like smelling, visual, hearing, tasting, etc. I will show you how it's going to work in the video. Okay, just keep going. Hold on, and I will show you how. Share here.
the speech function, as well as the smell, taste. I am working very much covering of sports lesson.
Okay, so you have learned until now two special techniques, two special steps of facial reflex therapy Sorensen system to use. The first one for the muscular issues, muscular injuries, muscle spasm, joints pain, etc. This amazing one, you'll try it, and you give me the feedback after this workshop or after this webinar. The second one, as I said, you can use it for any spinal cord problems. With any, if you are a physiotherapist who's working with pediatric CP children, or any children who has a problem in the peripheral nervous system, if you have a patient, or whether adult or pediatric, who suffer from visual function, smelling function, hearing function, tongue or tasting function, this is amazing one for you. You can use it. Of course, it's not everything. We have lots of tools. You can use it if you learn the diploma. But at this point, it will help you a lot as a physical therapist. If you are applying your protocol as physical therapy and you add this tool, you will find an impressive results. Just try. I'm not telling you like something, it's like a magic or something like that. It is something working, and we are working with it with many patients. I have many students also, and I have many colleagues around the world. We are getting amazing results. So in this way, you can try and work. First of all, work with the first map, and then work with your patients. I ask you to apply it on yourself first, and then apply it on your family or on your patients. But if you are going to apply on your patients, make sure to make it at the end of your physiotherapy session. Not always to be at the beginning. It's better to finish it with it. You are working using index, both index, press and pull. It's a rule. Press and pull. Do not pull directly, because if you pull, you're not reaching the point that we are looking for. You have to press first and pull. The second thing is to be as when the stroke is shorter, we are looking for shorter and deeper. Okay. Then you press and hold for 90 seconds up to 1 minute. Up to 2 minutes for the area or the most painful area. In this way, you will find it. Okay. So we don't have much time. So if anybody has a question, Physio News 24, please share it with me to discuss before we have done, because we nearly have like 20 minutes to finish. So Shamin and Malik, are you there?
Yes, sir. We are there, and thank you, sir, for your nice presentation. And I would like to request the participants, if you have any question, any question, then you can ask, and we can show it on the screen, and sir will give the answer.
Sure, I'm here. I'm waiting. Yes.
Yes. I'm looking for some questions. That is, sir, during your lecture, somebody asked about any media you have to use. Already you have mentioned that is oil and cream for using on your hand during on your face.
Okay. Usually in our treatment we prefer to use oils, not cream. But if you don't have oils, you can use cream, but do not use lotion, because lotion it's always absorbed inside the skin, and you'll not be able to work. You'll make like skin burning sensation. So to be able to apply it in the right way, we need a lubricant. We need an oil or a cream. So whatever you have, but make sure to be a natural source, because at the end it will absorb inside your body. Do not use like petroleum-based or creams. Look for natural way. I think that you in your countries, you much better than our countries. You have lots of natural things to use, herbal-based oils. Okay.
Sir, how many times in a day we can use this type of technique?
Well, you can use per session. If you are the whole, if we are talking about like step of muscular map, the first map that I show you, it will take from you 10 to 15 minutes of working. It's not easy. So it's one time is more than enough. In some cases we need to work twice, but not more. Okay, because they have a body effect, body reaction. I don't want to like overstimulate, because it's at specific areas. It's directly attached with the nervous system. So if I'm going to overuse it, it will become not good at all feedback for the patient. Okay, so once or twice, and because our attendants here are physiotherapists, then I always say, at the end of your session of physiotherapy, apply it. Make sure that he's on supine position, and you sit behind over his head and work. He will stay and he'll go. He will finish a session completely different, in an amazing feeling after, especially if you are managed to combine both techniques, physical therapy and this one, but used in the right way. Okay.
Okay, sir. Another one of our participants, Dr. Bijoy Das, he has asked about any specific contraindication of this technique.
No. Unless you have an injury on your head, do not touch. But if you don't have any injury on the head, on the face, on the areas, you can apply it easily. It's a safe treatment, nothing else. But of course, if you're going to learn the full diploma, we have some contraindications in some specific cases, but they are 2 or 3 cases only. But in this technique that you learn today, no, it's for all people without any contraindication.
So, another participant asked about that. How many times we can apply this technique on place?
On place?
On place, how many times we can apply, sir? Like on spot, how many times?
On what?
Like in face, any specific point, how many times we can apply that?
Okay. Generally, in the map, if you are talking about the whole map, it will take you like 10-15 minutes. But if you are going plus to concentrate, you have to work not only to count repetitions. No, you'll still keep working on it until you feel that the painful area or the hard area becomes a little bit soft, a little bit. Then you press and hold. That's it.
Okay. Sir, in a specific condition, how many sessions it will require for to improve that? Like any fixed session is there?
Well, there's a rule in our system. We never give numbers of sessions, never, because it's an individual thing. You know, in some cases it will take only 1 session. It will go on. Okay. Some patients needs 2, 3, 10 sessions according to the situation. You are a physical therapist, and you can know. I mean, you can know that it is a severe case or a chronic case or an easy case. So, but the good thing, as I said from the beginning, that it is a miracle method. You'll find a quick results on it. This is the most important thing, and easy to learn, easy to apply, and easy to teach to patients. But never ever say that I can treat you within 1 session. Never say numbers. Never. Okay.
Sir, any age restriction, like over this age we can apply this technique?
Any what?
Any age related restriction is there, like we can apply during this age or this age?
No restrictions. No, just if you have your hands, you have your oil or cream, and there's no injury on the face, you are okay. You can apply it. You can apply it easily.
Sir, another question from Bergman reflexology. That is, what is the Bergman reflexology?
Okay. What is it? One?
That is another question come from, that is, what is Bergman method facial reflexology?
Bergman?
Yes, sir. Bergman method. That is, what is the Bergman method facial reflexology?
I don't understand the question. Sorry.
Okay. So, okay, sir. Another is what is the that is better feedback? Someone, Dr. Atik asks, that is, if anyone have the acute cervical pain, then what is the better feedback by using this type of technique?
If you have a cervical pain?
Acute cervical pain.
Acute cervical pain. You are using the same thing. You have to apply here Then you go down and work on the shoulders as well. Then you find a painful area and press on it. You'll see the results. I'm asking everyone who's listening to me now and watching this webinar, please apply. I'm always when I'm teaching people, they have lots of questions all the time, but they have the answer when they apply. They have to apply. Okay, if they find the results and they find the answer of these questions, just work on it. It's easy. Give the chance for yourself as a therapist to work on it. Okay, and you'll feel it. Okay. Can I?
Another question. Sir, another question is from like why are there so many different reflexology in foot maps?
Okay. Well, to be honest, now if you are looking for maps on the social media or on Google or etc., in foot you have a difference of the maps in many different schools. Okay. Now in the last century, there's the best therapists or medical doctors who find a new maps. On that is Dr. Jesus Manzanares in Spain and Loine Sorensen. They found new things and more accurate things. So in our school, as I said before, that we are basically working on face and hands and feet. Okay, so these microsystems and the difference in other schools like in UK and in America, honestly, in my experience, they are not working in the right way. They are very, very, very old thinking, and they cannot treat patients. They don't have this ability to treat patients. Now, the difference of maps, it's become by experiences. I mean, this basically the old ancient. Because we have Chinese, we have Vietnamese, we have Korean, we have even Egyptian, we have South American, and the Indian people in South America, the old cultures, they have many methods to work. Now, facial reflex therapy, according to Loine Sorensen, is basically the basic things is become from South America, from the Andes mountain. It's not Chinese. The face, it's not Chinese at all. Okay, but the hands, it's Korean basically, but and more let's say more combination. Loine Sorensen made a combination of that therapy to give us her own method. Okay, so maybe I hope that it is the right answer, if it's the answer that he's looking for.
Yes, sir. Sir, another question is like, what is another question is Joan facelift. What is Joan facelift? Joan facelift.
Joan facelift.
Joan means area. There is Joan. Area means
joints.
No. Jone. Joan facelift.
Joan facelift. I don't know.
Okay. Another question is for any indication.
Okay. So please, if the spelling is not true, please write it so I can see it. It's better. Okay. Now zone facelift. Zone we have in facial reflex therapy. We have points and zones. Zones, it's like, let's say a zone. This area is a zone. Okay. So when I'm going to work on it, I have to apply like this. It's a zone. Okay, simply it's as it is. But if I'm pressing here, there's a point, nerve point. It's like when you are using needles, it's like acupuncture. It's a point. Okay, but we are talking about a zone. It's an area. Okay.
Okay, sir. Any indicative approach or any process for autoimmune disease like muscular dystrophy? We can use this technique.
Well, now we are working a lot with MS patients and fibromyalgia and lupus, etc. It's a whole system. But if you would like to know about it, you have to learn. But basically, when in our way of thinking is that we are looking for working on the immune system itself, because autoimmune the immune system is attacking a specific part of the body, like MS attack the myelin sheath. Okay, so in our system we are working on the root, is by applying a specific protocol to balance the immune system function. Before we go to we are not working the MS on the brain. No, we are working on the MS as an autoimmune disease on the immune system to balance it. Plus, we are working on to improve the function of neurotransmitters, which is hormonal system is responsible on it. Plus, in addition, we are working on the colon and the gut area, because it is the area that's attaching with the brain and hormones and lots of things to apply on it to help the patient. But it's a long thing. People will not understand until they learn. Okay, it's a huge one.
Thank you, sir. And already we have almost finished. Yeah. And thanks for your nice cooperation. And I think it's just a okay. Already we have given the sir many different
software. Why are these? There are so many Reflex maps. Yes, it's normal. It's normal. But in my experience, guys, our maps are the most accurate maps. We have. If you are looking for Google for food, forget the face. I'm talking about food because it's the most famous one, or most popular one. In food, in our treatment, when we are teaching, we have a muscular map, full muscle map on feet for the whole body. We have a full map of brain. We have our MRI of the brain. We can find in specific area on the feet. Each part. We have the spine. We can do mobilization and manipulation for the spine vertebrae through feet, but you'll not find on Google. Never. It's only our special maps. If you go and learn, you can see it. So the difference is between it's about experience. The therapists, they think that they find the right one. In general, they are nearly the same. But if you're going deeply, you'll not find on Google. You have to learn it. Okay.
Thank you, sir. And due to this Corona situation, we are totally locked in house. So we have to learn by this online program. But we hope so that very soon we can get option from you. That is, we can complete diploma from online or any other ways we can complete that. Because
I hope to come and join you and your country. It's my pleasure, but you can see the situation. We are not allowed to travel, and so that the only option is to teach online. And actually, it works well. I mean, I have lots of students who learned with me online, and they have amazing results with patients. So why not?
Yes, thank you. And sir, if it is possible, like a short session you can conduct, and then we can cover the diploma in the easiest way. That will be also possible.
Well, what's the question?
Like a short session, you are covering one of the part of the diploma, then we can easily cover up through this online program.
Well, we have something we can give you 2 days of introduction of facial reflex therapy. And you can get certificate from the International Institute. Actually, it is with cheap. It's $60 only. So you can learn more about the therapy. You can learn something to apply more and more, and they can try it. Then they decide. Most of people who joined the introduction course, they enrolled and they applied to the diploma, because the introduction is not enough for them. But at least, like the webinar that we did today, you can get results. The idea you can get results, but as Lawrence Sorensen said always, we are looking for the source of the problem. We are looking for treating the patient in the right way. Okay, that's why in our system we get amazing results. We nearly solve problems, or we improve quality of life in amazing way. So that's why, and it's not I know it's not cheap, but at least it's for business wise, you can get lots of money, believe me, and you can help many patients.
Yes.
If you are still working in your clinic, you'll find lots of results. Your way of thinking as a physical therapist will be more, because I know physical therapists how the way they think, especially if you are working with neurological cases, you'll find many answers of your questions with patients through this concept. That's it.
Thank you, sir. Thank you. Thank you very
Thank you,
much.
Shami. Thank you, Malik.
Thank you, for your nice presentation. And আমার মনে হচ্ছে যারা আসলে ছিলেন সকলে এনজয় করেছেন।
Thank you. I hope to hear from you about the feedback of people,
Yes,
and
sir.
how
Of course.
we can repeat this one or do something new, a different way. They can learn something on the feet. We have a small one-day course on the feet. It's foot reflexology for muscular problems. How to treat muscular problems by connecting the muscle groups with the organs. I can teach it. It's amazing one. It's only one day, like 6 hours continuously. We can discuss later all that, no problem.
Yes, we will try to arrange that type of workshop again, sir. Yes, we hope so, sir.
Okay, take care. Thank you.
বন্ধুরা, আমরা দেখছিলাম আজকের চমৎকার এই প্রেজেন্টেশনটি, বিশেষ করে ডক্টর শান্তনু মল্লিক এবং ডক্টর আতহারি, যিনি আসলে জর্ডান থেকে আমাদের সঙ্গে যুক্ত হয়েছিলেন। তো ফিজিওথেরাপি এই সম্পর্কে যে বিশেষ করে বাংলাদেশের পাশাপাশি আমরা ফিজিও নিউজ যে কাজগুলো আসলে করছি, আমরা চেষ্টা করছি আসলে ফিজিওথেরাপি বিভিন্ন ডাইমেনশন গুলোকে আপনাদের সামনে নিয়ে আসার জন্য। আমরা অনেকেই এখনো আসলে চিন্তা করি ফিজিওথেরাপি মানে আসলে খুব সিম্পল কোনো জিনিস বা শুধু বাত ব্যথা প্যারালাইসিস এগুলোই দেখবে। আসলে এরও যে অনেক ভেরিয়েশন আছে, ট্রিটমেন্টের ভিতরে অনেক নতুনত্ব আছে। তো সেই জিনিসগুলো আসলে ফিজি নিউজ আপনাদের সামনে হাজির করার চেষ্টা করে যাচ্ছে ধীরে ধীরে। তো আশা করি সকলেই আমাদের পাশে থাকবেন। আর এই মুহূর্তে ভালো থাকুন, সুস্থ থাকুন, নিরাপদে থাকুন, আর আমাদের সাথেই থাকুন। আল্লাহ হাফেজ।